This is the injury report presented by NYU Langone Health.
The Mets bullpen was dealt a major blow with the news that lefty A.J. Minter is dealing with a lat strain that could potentially end his season. Minter and the Mets are mulling whether he'll undergo season-ending surgery or he'll rest and rehab the injury to possibly return at some point later this summer. I have NYU Langone Orthopedic Surgeon Dr. Kirk Campbell here to join me to discuss this injury. Doctor, thank you so much for joining me this afternoon. So Minter and the Mets, they're deciding whether they should just rest and rehab this lat strain or he should undergo surgery. What goes into that decision, and what would you say the positives are for each of those options?
So thanks so much for having me on. Very happy to be here. Very challenging situation. The latimus dorsi, one of the largest muscles, around the shoulder, plays a critical role in the way, that pitchers throw. Big decision in terms of decision making depends on the grade of the injury. Is it just a grade 1 strain? Is it a grade 2? Or is it like a complete tear, which is a grade 3 injury? Based on the grade, that's how we kind of determine, is this something he's able to rehab, or is it something that may require surgical intervention? So, I don't have access to his medical information. However, based on the information out there, it seems like it's a higher grade tear if they're considering surgery, which we, rarely do perform for these types of injuries.
Yeah, Carlos Mendoza said it was a significant injury, so that's probably the reason that surgery is on the table. So what would they be doing in that surgery, and how does, or I guess, how long would the recovery from that surgery typically be?
So in terms of surgery, if it's a complete, tear or avulsion of the tendon, it attaches to the top part of the arm. We call that area of the arm the proximal humerus. And what we would do, we'd reattach it back to the bone. So the tendon is off the bone. There's another small muscle there called the teres major that inserts in a similar region. And sometimes that muscle is also injured. So we'd reattach that as well. In terms of recovery, he'd be in a sling for about 6 weeks, give or take. Then he'll slowly start back up, working on his range of motion. You gradually build up strength. You gradually get back to throwing. But he'd be looking at, approximately, 5, 6 months, out from pitching if you were to consider surgical intervention.
And on the other hand, if he doesn't end up getting that surgery, the Mets say he would just need to rest and rehab the injury. So what would a return to play timeline look like in that scenario?
Even without surgery, the return to play timeline is also quite long for this type of injury. So he's definitely going to look at, a significant amount of time on the disabled list. If it's just a significant injury to the latimus dorsi. On average, for a higher grade injury, these pitchers are out, for about 3 months, 2, 3 months, give or take. That's the amount of time it takes to correct any underlying mechanics, to reduce the inflammation, irritation, and to get them back comfortable. Because you really rely a lot on the latimus dorsi, in pitching, and especially for somebody who throws as hard as he does, it's a very, very important muscle.
Absolutely. He needs to be at full strength, when he does return. And, whether it is surgery or that rest and rehab, what are the chances that he could return to his typical normal form after that injury is healed?
Fantastic question. So this injury in Major League Baseball is quite rare. Less than 1% of the injuries that players sustain are latimus dorsi injuries. However, there is a very high rate of return with or without surgery. So fortunately, whatever decision is made, he has a very high likelihood of being able to get back, to pitch. And literature shows that Major League pitchers are able to get back 80 to 95 plus percent, and able to get back to the same level that they pitch. So with the appropriate treatment, he should be able to get back out there. It's just a matter of timing and how much time he's going to be out.
So on the other hand, if a non-professional athlete were to develop a lat strain, could they also potentially require surgery? And if not, would they rest and rehab kind of the same way a pro athlete would?
So for our everyday, athlete that a lot of sports medicine doctors see in our office, most of it is going to be treated without surgery, unless it's just a complete acute avulsion in somebody who that does a lot of overhead type of activities. Is this a gymnast? Is this a volleyball player? That type of athlete. That you would consider surgical intervention, but by and large, this is treated non-surgically in the non-professional, the non-high level athlete, and people do get back to doing the things that they want in a similar timeline. It's 2 to 3 months, depending on the severity of the injury.
All right. Well, Dr. Kirk Campbell, thank you so much for joining us this afternoon. Always a pleasure to have you, and thanks for all that awesome information.
Hey, thanks so much for having me.